I'm Eric Parker. Coming up this morning on CT21, the push to get Connecticut vaccinated is picking up speed as more vaccines are set to arrive and more people are now eligible to get them. We'll meet one of the key people behind that effort. And outdoor dining. When indoor dining shut down last year, an executive order by the governor allowed service outdoors to expand to help restaurants keep running during the pandemic. But will that option exist once the pandemic winds down? And in our Sunday Spotlight, the coach's wife, Andrea Hurley, married to UConn basketball coach Dan Hurley, on her new podcast, Ball is Wife. It's all this Sunday, March 21st. CT21 starts right now.
From Channel 3, this is Connecticut's most watched current affairs program, CT21, with Eric Parker, sponsored by Hartford Healthcare.
Good morning. When the pandemic was in its early days, community health centers jumped in to run mass COVID testing sites. And while that's still happening, the push now is on vaccinations. As of Friday, another 400,000 plus people became eligible to get them, and the doses are now coming in quickly as vaccine production picks up significantly. Mark Masselli is Community Health Center's CEO and founder. He's joining us this morning. Mark, thanks for being with us. Your organization has been such a big part of this effort, so I'll start with this. How's it going?
Eric, good morning to you as well. Good to be here. We're enjoying the work that we're doing. As you said, we're picking up speed in terms of the number of vaccines that we're able to get into people's arms all across Connecticut. And we were fortunate to have 4 mass vax sites ready and have launched. So we're reaching people all across Connecticut.
As we see the groups who are eligible expanding, it seems everywhere you go, the conversation is, did you get an appointment yet? Did you find a time? Where'd you go? Did you go to VAMS? Did you go to MyChart? How did you get to it? What are you hearing on the front lines? We have a lot more people eligible. Is it going smooth? Is it still a struggle? Is it like trying to hit the Powerball? What's the deal?
I think it's more like getting the Willy Wonka golden ticket. Because it really, there is a surge coming on. As you said, Friday, we opened up to 45 to 54-year-olds, and that really brought in additional people coming into the system. But, slowly the federal government is increasing production. We remind people to be patient because the lines are going to be long, looking for appointments either on the VAM system or on 211. But I think the state is, really well prepared. But I do think we're going to ask people to be patient.
Now, we have some video of your mass site, one of your mass sites at Rentschler Field, and it really is amazing just to see the ability. Here's some aerial footage showing the cars lined up there. You can tell from this picture, Mark, it's not a room issue. It's not like you can't get the people through. It's just getting those doses, right? Is that still the struggle?
Yeah, it really is. And I want to give while we're proud of what we've accomplished, we didn't do it on our own, can't move forward alone. Salute to the National Guard, to all of the organizations that have been helping out, really making this a partnership. As you rightfully note, we could probably double or triple the size at a Pratt & Whitney Airport, simply needing more vaccines. And I also will make a request to anybody who's a vaccinator. We're both looking for volunteers and hiring. Both of those really are force multipliers in allowing us to expand the work that we're doing.
There is some news that there may be a bigger vaccine supply. We saw the governor push up the date for some of the younger people in our state to April 5th. And part of his rationale was the word from the feds is more is coming. Is that what you're hearing? And how will that change things?
Yeah, I think on the positive side, I think people now know when their time is, right? And I think there's been a lot of anxiety around that. So by opening them up, I think that will be good. There's still work to be done on the production side. It is increasing. We're getting a direct allocation from the federal government as a community health center, so that's helping the state a little as well. So those combined with productions, probably in May, I think we're going to start seeing more vaccines than we can maybe deliver at one time, which will be good news.
One of the big missions for your organization is to reach people who might not otherwise be able to get health care. And one of the big concerns in this effort is that there might be people left behind, people in underserved communities, people of color. How is your organization reaching out to those people, and what are you hearing when you do reach them?
Yeah, It's a great question. We're out in communities from Stanford to New London. We were at Building 1 the other day, Immigrant Support Center. We had the governor there. Over 350 people showed up to that event. We're in churches in Bridgeport and the like. We're also noticing one thing, and I think we may have seen this recently on the news. The more people are getting vaccinated, hesitancy is dropping a little. Because somebody I know who looked like me got the vaccine, but we're still going to have to do a lot of door-to-door work. The low-hanging fruit are people who come to the mass vax sites. The more difficult ones are people who might be agricultural workers or who live in public housing or who have limited English proficiency. Those are the people we're worried about.
I know the governor's office has said that providers of other healthcare services like community health centers have the ability to reach out to high-risk groups. You come in contact with a lot of those people every day through your other services, not the vaccinations. But is that one way that you can try to make that connection and say, hey, you're here for your diabetes care or you're here for whatever else, mental health treatment. But while you're here, let us talk to you about this.
Eric, that was spot on. We care for this last year, 100,000 unduplicated patients came in even during the pandemic or saw us or were provided services. So those people will be able to reach. Remember, though, there's been a little shift. We've moved to telehealth. So some of those patients, while we'll care for them, aren't in the facility. But you're absolutely right. For those who are coming into our facility or hospitals, we're going to be able to get that vaccine in their arm when they're there.
All right, we're about a minute away from the end of this interview. I want to finish with this. What's a reasonable expectation for people? We just saw 400,000 more eligible, and then we will have a bigger group coming in on April 5th. What's reasonable for people to say when I can expect to get that shot?
I think patience is going to be the key word here for people. I think our hope is that the state continues to increase these hubs and makes more spokes available so there are more locations. I think it's going to be a couple of weeks of patience and waiting. But Eric, I think about it when you schedule your annual physical, even though you need it, the provider says it's going to be in 2 months and you're okay with that because it's coming. I think we want to get people in that mindset that the appointment is scheduled, we're going to get you in there and be patient.
Well, hopefully people will continue to be patient. Mark Masselli, the CEO of the Community Health Centers, thank you to all the folks at your organization for the good work you do, and thanks for being with us this morning. Coming up a little later in our program, we'll tell you what it's like to be the coach's wife. That's the focus of a new podcast from Andrea Hurley, the wife of UConn men's basketball coach Dan Hurley. She'll join us. And up next, outdoor dining. The rules changed to allow for more of it during the pandemic to help restaurants hold on. But what happens when the pandemic ends? That's coming up.